Hello everyone, I'm Zakia Mouni and I will do this presentation entitled Co-Creation of a Relaxed Performance in a Theatre Environment in Montreal with my colleague Natalina Martiniello on collaboration with Dr. Tu Poldma and Dr. Walter Wittich, the two co-directors of this research project, and the other collaborators as researchers are Dr. Eva Keaya and Ingrid Verdict. We did this project in the Centre Segal for the Performing Arts in Montreal, Canada, to understand how transforming the environment supports both performers and audiences alike in their theater experience. This community, as a partner of this project, which is the Centre Segal, has taken important steps to improve physical accessibility and access. In 2015, it committed to expanding its programming and operations to welcome everyone into the audience such that all are able to experience the performances without barriers. This project enhances this initiative and expands the center's accessibility scope. The objectives are to identify first existing barriers faced by individuals with diverse disabilities when assessing and experiencing activities such as theater performances. Second, to document and understand the lived experience of the audience attending a theater performance. And third, to understand how the physical and social environment might be adjusted for different needs and desires as expressed by persons living with disabilities and their families. A relaxed performance is designed to make the theater space more comfortable and welcoming to audience members who will benefit from a more relaxed sensory experience and casual environment, including but not limited to patrons with a notice spectrum disorder, a sensory processing disorder, or a learning disability. This performance is for patrons of all ages and abilities. Other audience members who may benefit from relaxed performances include young children, people who experience anxiety, or people who are not comfortable with the conventions of a traditional theater space. This intersectoral research project explores how a participatory approach leads to change that promote accessibility within a live theater performance, making it accessible to individuals with different abilities, and what factors in the environment might be changed to accommodate different disabilities and facilitate the experience of the audience as a whole. This research project proceeds in 4 phases, embracing a participatory approach with design thinking, wherein co-designing the various materials where the performance depends on the discussion with both the theater personnel and the researchers at each phase of the project. The team included 3 participants living with a disability, such as person in wheelchair, person on the autism spectrum, person with a visual impairment. The personnel at the theater and the local stakeholders involved in the project, including the Federation CGA, local community partners, cultural groups, and rehabilitation research centers such as CREER, Institut Nazareth et Louis Braille, Centre de réadaptation Lebridge Leighton Mackay, and the research team consisted of researchers from differing subspecialties from the health rehabilitation disciplines, architecture, and design. The artists and audience members of the relaxed performance also participated in the evaluation of the relaxed performance. A particularly innovative aspect of this project was the composition of a research team from different perspectives. The partnership of the center was vital as they provided the venue and were both a catalyst for the research project and enabler for change, providing suggestions for the various aspects of the theater and the resultant adaptive technological tools that were subsequently considered as integral aspects of the performance. The theater itself to assist participants in understanding how to determine the environmental issues within the theater complex. The second phase consisted of a walkthrough with all project participants together with the researchers assessing facilitators, challenges, interior attributes, language, and spatial barriers. Researchers documented the theater space during the theater walkthrough with photos of the pre-environment using the environment quality satisfaction tool and assessed what accessibility elements already existed and how spatial and social environment attributes might influence social and physical participation. From these two phases, the research team gathered the information to be used to inform the preparation of the relaxed performance. In the third phase, the team evaluated pre-performance conditions. During the fourth phase, the performance was presented and the project team and the audience participants from the first phase participated in a rehearsal to clean the possible issues and challenges that may arise. The relaxed performance took place following this initial assessment with the team members and the audience participants from first phases evaluating the successes and unresolved challenges of making the event accessible as a relaxed performance. During the walkthrough, the aim was to identify the issues related to universal accessibility and the visual elements, noise, linguistical and physical issues, and also issues for the audiences and actors of the shows. During the relaxed performance, it was essential to observe the audience members and their lived experience and consider the success of the implemented linguistic and visual adaptations, to attend also the performance and to participate and attend post-performance discussions with all stakeholders and the actors, and also the theater director. The center itself prepared for the relaxed performance by organizing a quiet room for persons needing such as a space, understanding the possible high stimulation for some participants. They also prepared and organized with the research team and partner technological aids such as the tactile map and also the audio description used during another performance after the relaxed performance we attended. Finally, a post-performance analysis proceeded in two distinct stages, first after rehearsal and second post-performance. During these phases, researchers noted aspects of the proposed relaxed performance that needed fine-tuning. During the post-rehearsal interview and analysis, both audience participants and actors with disabilities provided important feedback. The data of the themes and issues faced by participants and theater actors or personnel, both before and during the performance, led to the development of strategies for the implementation of the various support mechanisms for the performance itself. This participatory approach and the collaboration of all project stakeholders made it possible to suggest proposals for adapting the Segal Centre's environment. Three areas that were strategic for the success of the relaxed performance included the environment itself, the development of sensory and technological tools, and linguistic documentation. Natalie, my colleague, will now discuss each of these elements.
For patrons with visual impairments, barriers related to both the physical environment and the theater performance itself were highlighted. So a number of solutions were introduced, including the use of a 2D tactile map, a verbal visual story of the physical space and the performance, and audio description of the show. So the 2D tactile map, which included braille labels, was developed to provide patrons with an overview of the physical layout. Patrons were told about the tactile map when they arrived and had an opportunity to explore it. With visual impairment, it can sometimes be difficult to understand how different areas in the physical environment connect to each other. For example, a patron may know how to get from the main entrance to the box office, but may not know how these areas relate to other areas in the physical environment. So participants expressed that the tactile map provided a really useful high-level overview to help address this barrier. In addition, all patrons were provided with a verbal visual story in both large print and braille prior to the performance. The visual story was written in linguistically accessible plain language, and this provided patrons with a verbal description of the physical layout and also what to expect at the performance. Finally, live audio description of the performance was introduced through the use of an iOS application that was fully accessible to patrons with visual impairments and also available to anyone who wanted to use it. So through the use of headphones, patrons could use this application to access trained audio describers who were present at the event and who provided important information about non-visual aspects of the performance to facilitate understanding. This application was also helpful because it enabled those with hearing impairments to adjust the amplification of sound as needed. This was very well received by participants, and the Segal Centre started using audio description after this performance as well. So auditory and linguistic supports. The goal here was to ensure that all materials would be linguistically accessible to increase accessibility and inclusion for all patrons, regardless of their abilities, so that they could attend and understand the content of the performance. So 4 websites were used to facilitate this, and one of our team members, Dr. Kehea, use these websites to modify the written materials provided by the Segal Centre. So this included adjustments made to the informative pamphlet for the performance based on psycholinguistic norms and respecting linguistic accessibility criteria. In addition, captions were provided for individuals with hearing impairments, as well as simultaneous sign language for the culturally deaf, which the Segal Centre has used for select shows. So there was a general lack of large print and braille and other visual signage at all levels of the physical space. For example, patrons described that the signs at the box office were very small and difficult to read. So several pictograms were suggested for the relaxed performance, and also recommendations about braille and large print signage to help patrons locate key areas, for example, the washrooms, were also made. At the bar, a braille and large print version of the menu was provided. Though not shown here, this signage was also recommended by participants in the theater room itself, especially due to the lower lighting during performances. For example, braille and raised print signage on the sides of seats to help people find where they're located. While this signage is helpful, patrons also noted that they may not be aware that these signs are present, particularly patrons who rely on braille. And so it's recommended that these features are advertised on the website and also during the registration process as well. So if we focus on the physical environment itself, it's worth noting that about 85%, a majority of patrons who access this theater space are older adults who may have experienced a variety of physical or mobility impairments. And who may use a walker to navigate as well. And so there are two entrances to access the building. The main entrance has no ramp, only stairs, so it is not accessible. There is an accessible back entrance on Westbury with a ramp, although some patrons did express that it can be difficult to orient yourself from this accessible entrance because there are no clear signs to find the box office or other locations. Many patrons may be dropped off or accompanied to the main entrance when they arrive, and so it was highlighted that there is a need for buttons to assist in automatically opening the doors, which can be quite heavy, but also tactile and high contrast strips at the top and bottom of steps. To assist those who are blind or who have low vision in alerting them to these steps when navigating with a white cane or other mobility aids. There are also steps inside the theater space itself to access the theater rooms. And the steps here, the coloring of these steps are quite solid. So again, there's a need for tactile and high contrast strips to facilitate accessibility there as well. The noise in the lobby was deemed to be appropriate, but it was recommended that counters and tables and the bar area as well should be adjusted to facilitate access for people who are using wheelchairs as well as for those who use service dogs such as guide dogs to access these spaces more easily. We'd like to next talk to you a little bit about the Quiet Room, which was actually an initiative of the Segal Centre that was very well received. And this was very helpful during the performance as a place that people can go to relax and just have a quiet space for as needed. And so this space was very large and had several quiet corners, as well as sofas and chairs and mats on the floor. The space was very strategically located, so was very close to the lobby and the theater room, so easily accessible to people who can just use it when they need a break or just a quiet environment for however long. So while the idea of the quiet room was very well received, it actually wasn't really used very much during the performance. And so it was really highlighted that this needs to be advertised more, both where the quiet room is located and who may want to use it, as well as the fact that it really is there as a space that could be used for anyone, regardless of your abilities or disabilities. So this study highlighted different barriers experienced by patrons with different abilities when accessing a theater space, taking into account physical, social, communication, and linguistic aspects of inclusion. A cornerstone of this work is recognizing the importance of universal access and the fact that when you improve accessibility and inclusion for people who experience disabilities, this often ends up benefiting others as well, especially when you take into account the age of patrons who access this space. These efforts included increased physical access, but it's also worth noting that this also enhanced social awareness. For example, many patrons without disabilities approached blind patrons to ask about the Braille programs that they were reading during the performance, commenting that they didn't realize that these features could be, that these tools could be developed and that they should be offered in more public places. So it was a really vital public education moment as well. The Segal Centre has been very proactive throughout this collaboration and has worked very closely with the research team. While obviously the physical accessibility recommendations still need to be pursued, and that's partially due to the pandemic that has slowed some of these efforts. Other recommendations have already been implemented, for example, training provided to staff, and this has also led to the development within the research team of information and resources that staff members could use as well. For example, how to provide appropriate sighted guide for patrons, etiquette on interacting with patrons who use service and guide dogs, and information about producing accessible web and website and documents as well. So with that, we would like to thank our fellow research team members and all of our partners, including the participants and patrons, and all of the staff at the Segal Centre for collaborating with us on these efforts, and we are happy to answer your questions.